Good evening to you and your family. Thank you for being with us. On a day when Canada's COVID-19 death toll topped 15,000 people, there are now growing concerns about the arrival of a more contagious variant of the virus. Canada has at least 5 confirmed cases of the variant. Alberta reported a case just this afternoon. All have some connection to travel to the United Kingdom, where the variant was discovered earlier this month. The federal government now facing calls to increase screening, to further limit non-essential international travel, and to speed up the vaccine rollout, which was largely halted over the holiday weekend. Oxford University is tracking the number of vaccine doses administered worldwide. As of Sunday, Canada had administered about 52,000 doses. That's fewer per capita than Israel, Bahrain, the UK, and the US. While parts of this country are still waiting to receive their first vaccine shipments, Global News has learned Canada's biggest province says it's changing its policy and no longer going to reserve doses for second shots. Here's Abigail Bimman.
With no readily available national vaccination picture, the COVID-19 Canada Open Data Working Group built its own.
Quebec, for example, has rolled out the vaccine in just about every part of the province, if not every part of the province.
But Ontario is being criticized for cutting capacity over the holidays, concern heightened with cases of the new UK variant now in Canada.
It's not good optics to have these clinics shut down for a number of days when we're being asked to keep making significant sacrifices.
Ontario says the pandemic exacerbated staffing challenges, and it was hospitals that asked for an amended schedule. But the health minister's office tells Global News they expect to get all their initial 90,000 Pfizer doses into arms in the next several days. And in a change to their initial policy, they will no longer reserve second doses. Meanwhile, the federal health minister's office tells Global News Moderna vaccines are arriving in the Northwest Territories and Yukon Monday, 7,200 doses each. The rest of the first 168,000 doses will roll out to provinces and territories this week.
I think they have been moving too slowly. And, this virus knows no borders. It knows no jurisdictions. It knows no holiday time.
Federal opposition parties are calling for more data around both vaccines and genome sequencing to find variants.
I don't understand why Canada isn't able to vaccinate at the same rate as countries like Israel or, the United States. Other countries around the world, I think, are ahead of us on that. And really, the federal government needs to explain why.
Really roll out the vaccine or vaccines now, actually, as quickly as possible.
President of global research group CFAR and a member of the federal government's vaccine task force, Dr. Alan Bernstein says we should be doing several things in the face of the new variant and be prepared for other variants, including ones that develop here in Canada.
We need to do a lot more DNA sequencing. We need to understand if there are new variants, what their properties are. We need to up our game on contact tracing.
The Liberals are defending their vaccine plan. The health minister's office telling Global News their, quote, approach is delivering, putting the onus on the provinces to get them out as fast as possible, but offering few details about how many doses are going to them and when. Farah?
Abigail Bimman in Ottawa. Thanks, Abigail.